The dentist will see you now.
The story of how a cast of millions become entrenched inside the structure of teeth and end up causing the largest number of diseases ever traced to a single source.
About 300 years ago, someone adopted the idea that if the centre of the tooth is cleaned out, the tooth will stop hurting and you can still eat on it. So was born the religious practice called root canal therapy. All dentists are trained to do root canal therapy. Some of them have another 2 years training to become specialist root therapy practitioners. They're called endodontists. One of Australia's leading endodontists, Dr. Paul Abbott, wrote,
"The main concepts, aims and procedures in endodontics have changed little during the last 300 years.
There are many reasons you might hear your dentist say that your tooth will need a root canal therapy. Accidental damage. Yeah. Damage to the tooth caused by amalgam fillings. Yeah. Pain, no matter what the cause. Yeah. Believe it or not, even to get that perfect smile. The most common reason is a decayed or dead tooth, with or without an abscess.
It first started when I was 14 years old. I had an abscess, which was on the roof of my mouth. So I went to the dentist and he found that it had killed one of my front teeth. So he recommended that I have a root canal therapy done. So I started taking antibiotics to treat the abscess and I had the root canal therapy done. And everything seemed to be fine for a while.
A root canal therapy is the procedure of removing dead infected tissue from the inside of a tooth, then attempting to clean, sterilize and fill the canal which runs down the center of the tooth. The dental profession call this saving a tooth. The first step is to drill a huge hole through the crown of the tooth. The pulp chamber is exposed and cleaned out to gain access to the top of the root canal. The canals are then scraped out using files of increasing diameter to remove dead tissue from the inside. In this process, some of the debris and bacteria will be forced through the end of the root into the surrounding bone. Further scraping and filing is done to widen and shape the canal for the final filling. The length of the canal is judged by taking an X-ray of the tooth with a file inside the canal. The difference in length is then calculated to estimate the correct root length. This is at best a good guess, as dentistry has still not found a way to measure the length of a root canal with precision.
The next step is to try to sterilize the tooth. This is done initially by washing the inside of the tooth with hydrogen peroxide and sodium hypochlorite, the bleach used for cleaning dirty nappies. A concoction of medications is placed in the tooth and the tooth is sealed with a temporary filling. The most common medicaments used for this are camphor, phenol, menthol and formaldehyde. These have been used for over 100 years. This process is repeated until the tooth stops hurting. When the tooth is considered sterile, it is ready to fill. Slow-setting cements are spun down the canals. Gutta-percha points are inserted next. They're packed in tightly to try to completely seal the canal. Supposedly, this will stop bacteria from getting into the tooth and reinfecting it. A temporary filling is then placed in the crown of the tooth until the final restoration can be completed. To understand why root therapy may not be such a good idea, we need to understand the anatomy of a tooth and how it relates to the rest of the body. They're not just big chunks of calcified material. Teeth are a complex and integral part of the body. They have feelings. The enamel is the part of the tooth that we all know as the crown with which we eat, bite and smile. Dentine makes up the inside of the crown and the bulk of the root of the tooth. Down the centre of the root is an empty space known as the root canal. This canal opens at the end of the root, called the apex, deep in the jawbone. Through this opening enter the nerve fibres and blood vessels which bring nutrients to the tooth and take away the toxins. These contents of the canal are called the dental pulp, or in lay terms, the nerve of the tooth. Around the outside of the tooth is another slightly calcified tissue called cementum. It's very thin, and its main function is to attach the tooth to the membrane that surrounds the root, called the periodontal ligament. This ligament attaches the tooth to the bone and forms a fibrous seal to prevent infection tracking down the root. The tooth is surrounded by bone, which also has a rich blood and nerve supply and vast lymphatic drainage. Around the bone is the rest of the body. The dentine deserves closer inspection. Dentine makes up the bulk of a tooth. It's made of millions of tubes which run from the surface of the root canal to the enamel and the outer surface of the root. These dentine tubules contain tissue fluid and an extension of the cells which line the inside of the canal. There are 30 to 75,000 tubules per square millimetre of dentine. The bulk mass of any tooth is really a whole bunch of tubes packed tightly together. It's far from solid. Minute as they are, if you were to place the tubules of a single-rooted tooth end to end, you would have 3 miles of tubing. All of the dentine tubules in the root communicate directly with the surrounding tissue. In other words, they communicate directly with the whole body. Each of these tubules is wide enough to contain 8 bacteria in cross-section. Billions of bacteria can live happily in such an environment. These bacteria will penetrate to the full depth of the dentinal tubules, right out to the edge of the tooth. Through the dentine also pass the accessory canals. They contain extensions of the dental pulp, which in reality is somewhat like the taproot of a tree, with branches that reach out to the surface of the root, communicating freely with the rest of the body. The procedures involved in root therapy are clearly defined. Clean and prepare the canal to within 1 millimetre of the end of the root. Remove all dead tissue. Sterilize the tooth, no bacteria should survive. Fill the canal completely to within 1 millimetre of the end of the root. The belief that these objectives can be achieved is one of the greatest fantasies in dentistry and medicine. This belief system forms the basis of another belief, that a dead tooth cannot affect your health. X-rays are used extensively in root therapy. They are used to measure the length of a canal, to check the results of the root filling, and also to look for infection. Unfortunately, X-rays are at best a two-dimensional representation of a three-dimensional object. They do not give an accurate picture of what is happening in the bone or the tooth. As such, whatever is in the shadow of the root will not be seen. There may be nothing, or there may be a great big abscess. If a root has more than one canal, or if the canal divides halfway down the root, it is often missed due to the shadow effect on the X-ray. It is also common for a canal to split near the end of the root into multiple canals. These are nearly impossible to see and always impossible to treat. This is the original X-ray presented by the patient, which shows a large extraction site and a tooth with a gold crown covering some pins. Another X-ray at a slightly different angle shows that one pin is actually perforating the root and extending into the bone. This is what the root looks like. It was routinely misdiagnosed from the original X-ray. X-rays of teeth in the mouth can only be shot from one angle, the normal view. Measurements of teeth are made from images in this view only. Often the canal finishes short of the end of the root, but this can only be seen if the tooth is rotated 90 degrees. Thus, for the root filling to appear to be at the end of the root in normal view, it will in reality end in the bone. Weston Price found that 17% of root canals done by specialists were in fact overfilled. Interestingly, current research has come up with exactly the same figure. 100% of overfilled canals show a liquefying death of the adjacent bone. X-rays are also relied on to decide the state of infection of a tooth. Dental schools teach that if you can see bone loss on an X-ray, there is an infection in the tooth, and that if you cannot see an abscess, there is no infection. If an X-ray could show infection, there would be no need for microscopes or cultures, an obvious nonsense. Dr. Price pointed this out in 1920. Even if the bone looks normal on the X-ray, the tooth may still be heavily infected. The Australian Dental Association have stated that
all root canals in the affected tooth must be treated.
In other words, all dead tissue must be removed. Recent research, however, clearly showed that when teeth were cleaned and filed with every known technique, large amounts of decomposing tissue were left in the canal. Not one method used to remove the dead tissue from the main canal worked. The root canal is usually only a tiny part of the volume of the tooth. The dentine and its contents comprise the greatest bulk. What happens to the dead tissue remaining in dentine tubules and accessory canals? It becomes putrid and gangrenous. As it breaks down, it releases toxic gases and other breakdown products which may seriously affect health. These toxins leach out of the tooth all of the time. Some come out of the main canal, but a larger amount leaches from the dentine tubules and accessory canals directly into the periodontal ligament and the bone, and thus throughout the body. It is physically impossible to remove all dead gangrenous tissue from the tooth. Remember that this comprises well over 90% of the pulp tissue. The most dangerous of these toxins are undoubtedly the thioethers, for instance dimethyl sulfide. Thioethers are strongly related, both in their structure and their effect, to mustard gas and other poison gases used in the First World War.
They paralyse the aerobic action of cells. It is the vital organs, the liver, nervous system, endocrine glands and heart that are primarily affected. The nervous system is doubly affected by focal intoxication. The brain is a major target organ. Psychological effects are part of the symptomology of thioether poisoning. They are amongst the most potent of all carcinogens.
I was 19 and my period stopped, and so I went to the doctor and they said, don't worry, it'll be okay, these kind of things happen. And went on for 6 months and they still said, oh, it's okay, all right, we might do a blood test. So we did a blood test. It came back and it showed that I had really high prolactin levels, which is a hormone which the pituitary gland produces. So they said, okay, we're going to do a CT scan and an MRI scan just to check your pituitary and see how it is. Had both of those scans done, and they came back and showed that I had a pituitary tumour. The tumour was about 12 millimetres, which sounds quite small, but in comparison to the pituitary gland itself, the pituitary gland is only 1 centimetre itself. So it was actually a macroprolactinoma is what it was called. So that was a bit scary.
Dentistry does not like to admit that dead tissue remains in a tooth or that a root therapy tooth is dead. One eminent and often quoted endodontist suggested that
it is wrong to speak of root canal therapy as a dead tooth. It is more correct to describe such a tooth as non-vital, or better, pulpless.
The Oxford Dictionary defines dead as no longer alive. It defines non-vital as fatal to life. Pulpless means that the blood supply is gone. If the blood supply to any tissue is taken away, then that tissue dies. Dead is dead is dead. There is no such thing as a little bit dead. Most endodontic associations worldwide use this quote to try to sell root therapy to the public and the dental profession. Dentistry is the only medical modality which claims that it is good to keep dead, infected and gangrenous tissue in the body. Decay and infection are the most common causes of the pulp dying. Bacteria can be found in the pulp when the decay is only in the enamel. By 1976, over 88 species of bacteria had been found in dead teeth. The majority of these organisms are anaerobic. The materials commonly used to try and sterilize root canals include phenol, calcium oxide, camphorated phenol, camphor, formaldehyde. All of these materials are toxic to some degree, and some, such as formaldehyde, are extremely carcinogenic. The Australian Dental Association states,
"The role played by microorganisms has been demonstrated and cannot be emphasised enough. Elimination or destruction of all organisms within the entire tooth is essential for long-term success."
The entire problem of whether or not infected pulpless teeth should be extracted or may be treated should perhaps be settled right on this fundamental premise, for if this cannot be done, there is no basis for argument.
Weston Price even tried pouring fuming formaldehyde down root canals of extracted teeth, and was still able to culture bacteria from the depths of the dentine tubules. The only way he was able to sterilise a tooth completely was to boil it for 30 minutes. Many endodontists now accept the fact that it is impossible to sterilise a tooth. The tubules remain infected no matter what medication is placed in the tooth. But this is not new information.
In more than 95% of cases in which we have placed a medicament in a canal on a dressing, we have in 48 hours been able to grow cultures from the dressing that was placed in the tooth, regardless of the medicament that was placed on the dressing.
The bacteria inside a tooth can grow on anything, including formaldehyde. The dental literature from 1981 agrees.
In the case of an acutely infected tooth, there is no natural process of drainage, and there is no mechanism by which antibiotics can reach the bacteria inside the tooth. It is now known that complete sterilisation of an infected root canal is very difficult to achieve, and complete removal of all pulp tissue remnants frequently is not possible. The microorganisms are protected inside the canal from the defensive elements of the body, and the presence of dead tissue fragments can serve as a source of nutrients that will continue to feed the bacteria.
Anaerobic infections are not a problem, according to the American Dental Association.
Microbes do remain in the dentinal tubules of endodontically treated teeth, but pose no health hazard.
The reality is that anaerobic bacteria produce incredibly potent toxins called endotoxins. It is well known that endotoxins are found throughout the depth of the dentine tubules and that they leak easily from the tooth. They escape readily through the accessory canals, dentine tubules and the apex of the tooth, no matter what the tooth has been filled with.
The ability of oral bacteria and their toxins to spread from a site of focal infection, not only in the mouth, but also to other sites in the body, is well documented in the scientific and medical literature. Any oral bacteria which can migrate throughout the whole body and cause a wide variety of systemic diseases, as numerous studies have shown, has the ability to spread from the site of a focal infection to other teeth in the mouth, even healthy ones. Soluble poisons may pass from the infected teeth to the lymph or blood circulation and produce systemic disturbances entirely out of proportion to the quantity of poison involved.
Endotoxins have a wide variety of effects in the human body. They interfere with blood clotting. They alter the development of nerve tissue in the brain. They damage nerve tissue. They alter transmission within nerve fibres and may have other far-reaching and varied effects, including headaches, nausea, vomiting, depression, personality changes, nosebleeds and breathing difficulties.
It's now time that I should say that I'm breathing a lot easier. I could breathe in without opening my mouth all day long. The same at night. I could sleep in without breathing from my mouth. Whereas before it's completely the opposite.
They're associated with miscarriage and low birth weight children. They're associated with coronary heart disease, stroke and atherosclerosis. They cause allergic sensitivities. They cause bad breath. They're cytotoxic, they kill cells. They reduce the ability to breathe and will affect lung function severely. Asthmatics are at great risk. They cause cancer. Dentists are taught that the final filling is critical to the long-term success of the treatment. The filling must completely seal the canal. The problem is that none of the filling techniques work. Accessory canals, dentine tubules and secondary canals are ignored as though they do not exist. This means the bulk of the tooth is left unfilled. The research from the endodontic journals shows that all root fillings leak to varying degrees.
The American Association of Endodontists tell us that the root canals are sealed with a sterile, biocompatible material.
One would hope so, considering the published evidence which shows that whatever is placed in a tooth will be transported throughout the body. Gutta-percha points are cytotoxic and can cause severe allergic reactions in people with latex allergies. Root-filling cements contain a host of different substances, many of which are extremely dangerous. Some contain formaldehyde. All root-filling cements are cytotoxic. Not one could be regarded as biocompatible. Zinc oxide root-filling cements release zinc, high levels of which are found in distant organs. They induce changes in calcium levels in these organs. All root-filling cements are cytotoxic. Many root-filling cements are mutagenic. They cause changes in DNA, which could lead to birth defects or malignant transformation of the tissue. Many root-filling cements are also neurotoxic. This means that they damage nerve tissue. The materials tested blocked nerve transmission either partially or totally, and in some cases the effect was irreversible. Dentists are placing these materials into living human bodies all of the time. One root-filling cement, which is simply called N2, is used on a very large scale, despite the fact that it has been made illegal in some countries and its use has been declared not to conform to acceptable treatment standards. N2 contains zinc oxide and extremely high concentrations of formaldehyde, a known carcinogen, which is listed in the top 300 most toxic substances by the ATSDR. As long ago as 1981, the American Dental Journal has warned against the use of formaldehyde leaching cements.
If formaldehyde is clearly not necessary, why is it used at all, particularly in light of its deleterious effects?
The first sentence on the website of the American Endodontic Society is therefore insanely shocking.
The American Endodontic Society endorses and teaches the technique of root canal therapy, commonly referred to as the Sargenti or N2 method.
In other words, the American Endodontic Society endorses and teaches the poisoning of dental patients with formaldehyde. The position statement of the American Association of Endodontics presents a damning conflict of professional opinion. They recommend against the use of paraformaldehyde-containing materials.
Paraformaldehyde can cause irreversible damage to tissues near the root, destruction of connective tissues and bone, intractable pain, paresthesia of the mandibular and maxillary nerves, and chronic infections of the maxillary sinus.
Damage is not confined to tissues near the root. The active ingredients travel throughout the body: blood, lymph nodes, adrenal glands, kidney, spleen, liver and brain. Undoubtedly there are many other patients who have also suffered injuries because of these materials, but whose injuries have not been publicly disclosed. Today, the most popular root-filling cement used in Australia releases formaldehyde. In fact, the manufacturers of AH26 state that their product releases formaldehyde, ammonia and nitrogen oxides, and that it is a harmful irritant which must not be allowed to reach groundwater, watercourses or sewage systems. Yet this material is legally implanted into living human bodies every day. All materials placed in a tooth can be transported throughout the body within minutes. The vast blood supply of the surrounding bone carries toxins to all parts of the body, including the brain. Nerve fibres carry toxins along the length of the nerve back to the brain at a rate of about 250 millimetres per day. Some of the root-filling cements are so neurotoxic that the damage is irreversible. Is it a wonder that the trigeminal nerve is often affected by these toxins? Irritation of this nerve may produce paresthesia, neuralgia, and severe pains, including trigeminal neuralgia. Trigeminal neuralgia is not just a big name. It represents pain which is so intense that people have been known to commit suicide.
What happens when a baby tooth becomes so infected that it dies? Unlike an adult's tooth, the end of the root of a baby tooth is wide open. Obviously, you cannot insert gutta-percha points into such a canal, as they would keep going.
Dentistry has a solution. It's called a pulpotomy. The research which says that it should not be done is ignored. The top of the pulp is scraped or drilled out, and the rest of the pulp is mummified. The substance used is a mixture of formaldehyde and cresol, which is placed directly into the tooth. That's right. The specialist kids dentist, the pedodontist, is going to put formaldehyde into a baby tooth and call it a pulpotomy. Minute amounts of formaldehyde have been known to cause cancer in children. Formaldehyde spreads rapidly from the tooth to all vital organs of the body. A study published in the Journal of Endodontics in 1990 showed that exposure of the fetus to minute amounts caused physical deformity and severely retarded growth and development. Formaldehyde was found to be embryotoxic and teratogenic. The authors advised against the use of formaldehyde in young patients, pregnant women, and women of childbearing age. Worldwide, the majority of paediatric dentists still choose formaldehyde as the preferred material for pulpotomies. They continue to do this in spite of the fact that a viable alternative, calcium hydroxide, has been around for years. This is not secret information. It was published in the British Dental Journal in 2000. Pulpotomy is usually accompanied by the placement of a stainless steel crown over the tooth. Stainless steel releases large amounts of nickel, a metal which is well known to be highly immune reactive and can initiate a chain of events which may culminate in autoimmune diseases. Others, such as kidney disease, bedwetting and leukemia, have been associated with this treatment. A root therapy is considered successful if it looks good on the X-ray, the bone at the end of the root appears to be healing on the X-ray, the tooth has stopped hurting. All of these signs of success are restricted to the environment of the tooth. Systemic effects are never considered. Not many patients go to a dentist to find a cure for the breast lump or arthritic knees. The reality is that lack of pain is not a sign that there is nothing wrong. It is merely a sign that there is no local inflammation around the end of the root. Other areas of the body may become affected without local pain in the tooth.
In fact, lack of pain may constitute both what is probably one of the greatest paradoxes and one of the costliest diagnostic mistakes through injury to health that exists in dental and medical practice.
When a root therapy fails, which is very common, a surgical approach to fix the problem may be offered. It's called an Apus Ectomy. The end of the root is cut off and the abscess curetted out in an attempt at cleaning away the source of the problem. The real seat of infection, the tooth, is ignored. Toxins escape from the whole surface of the tooth, not just the end of the root. A filling is usually placed in the end of the root. The most common material used for this filling is mercury amalgam, an implant of mercury directly into the brain. None of these fillings seal the tooth. Even the Australian Dental Association agrees that this is a useless procedure.
Amalgam does not satisfy the conditions required of a root canal filling, and its use must now be questioned, although no studies have demonstrated which material would be ideal. When endodontic treatment has been completed, a filling or crown will be necessary. This will restore your tooth to its original shape and function.
These crowns or caps are usually made of a gold alloy with porcelain over it so that it looks like a real tooth. Most universities still teach that mercury amalgam is the best material to use as the initial filling, which will become the core for the crown to sit on. This practice flies in the face of warnings from the amalgam manufacturers. In 1997, Cork Company, the manufacturer of dispersalloy, stated that their material should not be used as a filling under cast crowns. The reason is simple. Combining amalgam and gold will cause a dramatic increase in the release of mercury from the amalgam. This constitutes a serious and avoidable health hazard. Save that tooth at any cost. That's the refrain of the dental profession. The only cost we are told of is the fee for doing the root therapy and the fee for rebuilding the tooth. A root canal therapy, about $1,000. Posts and pins, $400. Amalgam cores, about $300. And a new crown, about $1,700. The total cost, $3,400. The cost of disease is not included in this equation. The American Association of Endodontists homepage states that more than 16 million root canal procedures are performed every year in the United States. At a conservative average of $1,000 per treatment, this makes root canal therapy a $16 billion per year industry in the USA alone. Assuming that only 75% of these teeth are crowned at about $1,500 each, that's another $18 billion. If dentists paid only 30% of their earnings to tax, this would represent a $10.2 billion income for the government. The remarkable thing is that this treatment, which is so readily recommended by dentistry, has such an appalling failure rate. Even the Australian Dental Association acknowledges this.
Retreatment is a relatively common procedure, particularly amongst specialist endodontists. About 1/3 of all root therapies done by specialists will need to be redone. About 2/3 of the caseload of specialists is for retreatment.
In other words, if that first hit-and-miss approach doesn't work, you'll be advised to have a second go at the same hit-and-miss techniques.
And Robert looked at it and told me that it was pretty bad, and it did actually look kind of pretty horrible. I took away some kind of literature on root canal therapy, looked it up on the net, and looked at the choices that I had, and I sort of decided that I should have it out. It was pretty painful by that time.
Dental associations worldwide refuse to acknowledge that dead infected gangrenous tissue is a danger to health.
The British Dental Association is satisfied that there are no grounds for believing that endodontic treatment could cause general health problems. Dentists who are asked to extract a tooth on the grounds of press reports about the focal theory will refuse to do so on ethical grounds. It would also be unethical of a dentist to promote extraction of root-filled teeth as a means of alleviating illness.
Dr. Weston Price made comment on this sort of attitude 100 years before the BDA made their announcement.
This point of view is not based upon any great truth, but is confidence inspired by ignorance.
So then I came to see you, and I had the root canal pulled out, root canal tooth, and 3 months later I had another blood test, and the blood test showed normal, and we were very shocked. But we thought, we're not going to get too excited yet, we'll wait for the scan. So I had another MRI scan. This was 3 months after having the tooth pulled, and I got the results back, and they said there's no tumour there, it's a healthy pituitary gland. No other explanation to say that the tumour disappeared other than having my tooth pulled. My periods returned a few months later after having the scan done, and my blood tests are normal still. I went back up to my doctor, and he was also shocked. He didn't ask me why, what's happened, what's changed. He said, oh, that's strange. He didn't want to know, really. So that was a bit sad, I thought, but...
The Australian Society of Endodontology publish a brochure entitled,
Relax, there is no need to lose your tooth. Endodontics can save it for you.
It is still being used as a patient information brochure. The foremost root therapy specialists of Australia tell us,
once the tooth is fully formed, the main source of nutrition for the tooth comes from the tissues surrounding the root. A tooth can function normally without its pulp and can be kept indefinitely. After endodontic treatment, the tooth is pulpless, but it is not a dead tooth. The infected or damaged pulp is removed from the inside of your tooth. The root canals are then cleaned, sterilised and shaped to a form that can be completely sealed. They also talk about dressings which destroy any remaining bacteria.
In 1997, Dr. Gamble wrote to the Society and asked them for references to support the statements they make in their brochure. Following is their response.
The material was based on the committee members' general knowledge of endodontics and not on specific references. No specific references were used to write the pamphlet.
Australia's leading specialist endodontic society could not find one scientific reference to support the advice they give to patients. Not one. This begs the question, if the brochure was put together from the general knowledge of endodontists, then what is that general knowledge based on, if not on any published science? Jacques Benveniste, one of the greatest scientific thinkers of the 20th century, asks, why are scientists so opposed to the evolution of science? Is it to defend their piece of turf? Why, in the name of intangible dogmas, which the history of science has shown to be so often ephemeral, do they reject advances which represent progress for their discipline?
One thing I should mention is, for me to ascertain that something is correlated with another, it's very hard for me to say that. But what I do say is, like, you feel better and you want to go back and improve on your dental problems, on whether it's cleaning, whether it's root therapy, whether, your dentist should look at the root problems right there and try to cure it. And the cure is definitely worth the few minutes of pain under the scissors and under the...
In 2003, the Superior Court of California passed legislation requiring dentists in that state to display the following warnings in their surgeries. Warning: dental amalgam used in many dental fillings causes exposure to mercury, a chemical known to the state of California to cause birth defects or other reproductive harm.
Root canal treatments and restorations, including fillings, crowns and bridges, use chemicals known to the state of California to cause cancer.
As long ago as 1923, Dr. Weston Price published many years of research about the diseases associated with dead teeth. He demonstrated that every belief about root canal therapy held by the dental community at the time was based on a complete lack of scientific research. These beliefs, based in hope and myth, were later set in concrete by current dental specialists. Dr. Price demonstrated that teeth could only be sterilised if boiled for 30 minutes. The organisms and their toxins isolated from a dead tooth could cause many diseases.
The environment inside the dentine tubules is ideal for bacteria to undergo pleomorphic change, from aerobic, requiring oxygen, to anaerobic organisms, requiring no oxygen.
Current research shows that bacteria and other non-virus microorganisms cause cancer. Much of this literature stresses the likely involvement of highly pleomorphic bacteria as causing cancer. Dr. Price found that dead teeth could cause a wide variety of diseases.
Diabetes, hay fever, periodontal disease, asthma, rhinitis, skin conditions, neuritis, degenerative arthritis, nervous breakdown, stroke, kidney diseases, rheumatism, arthritis, heart disease, and cancer.
Dr. George Meinig was one of 19 founding members and a long-standing president of the American Society of Endodontics. After reading the work of Dr. Weston Price, he realised the dangers of root canal therapy and wrote a book called The Root Canal Cover-Up.
Dr. Meinig defines root therapy as the story of how a caste of millions become entrenched inside the structure of teeth and end up causing the largest number of diseases ever traced to a single source.
Current dental schools, however, continue to claim that Dr. Price's research was based on a false concept, the theory of focal infection. A clear definition of focal infection was officially published by the American Dental Association in 1951.
A focus of infection is a circumscribed area infected with microorganisms which may or may not give rise to clinical manifestations. Focal infection is sepsis arising from a focus of infection that initiates a secondary infection in a nearby or distant tissue or organs.
The concept of focal infection in relation to systemic disease is firmly established. The origin of many toxic or metastatic diseases may be traced to primary local or focal areas of infection.
The headaches had completely stopped, and it took about two weeks for them to decrease, and then 2 weeks had kind of completely gone, and they haven't returned since. And
strangely, our current dental professors seem to be the only people on Earth who now claim that focal infection does not exist. The rest of the medical world is based on this principle. The clear statement of the American Dental Association from 1951 is now denied in their current 2005 position.
Root canal fillings are safe. The focal theory of infection does not apply as related to endodontically treated teeth.
The Australian Dental Association holds similar opinions.
The focal infection theory became severely criticised with well-controlled research, leading to the dismissal of this theory and a return to a more conservative approach to dentistry.
Medical literature is replete with references to focal infection. In August 2005, Medline, the largest source of published scientific medical studies, lists 1,248 entries for focal infection and 1,805 for focal infection dental.
Lifting the lid on this Pandora's box clearly demonstrates the spread of infection from teeth to the rest of the body, and the dental profession's arrogant dismissal of published scientific research. Spread of infection from a tooth may result in cases of debilitation or dehydration, exposure to radiation, diabetes, cancer, blood dyscrasius, malnutrition, vitamin deficiency, leukemia, multiple myeloma, and diseases of the liver or kidney. In 1996, the Journal of Dental Research published that focal infection should be a major concern in dentistry. This paper has over 200 references. In 1997, a paper entitled Serious Complications of Endodontic Infections, Some Cautionary Tales was published in the Australian Dental Journal. It was written by Professor Laurie Walsh, who currently is the head of the dental faculty at the University of Queensland.
Professor Walsh states, while endodontic abscesses can cause significant morbidity, in susceptible individuals, they can pose life-threatening problems.
He cites many diseases as having been caused by infections in teeth. A small taste of the literature shows that dead teeth can cause a wide range of diseases. Immune system diseases, infection of hip replacements, abscess of eyes, cervical cellulitis and mediastinitis, necrotizing fasciitis, coronary atherosclerosis, sinusitis, multiple sclerosis, brain abscess, brain cancer, central nervous system damage, trigeminal neuralgia, and literally hundreds of other studies showing the spread of disease from oral infections.
In 1997, the respected journal Quintessence International state, "The detrimental effect of focal infection on general health has been known for decades. Chronic dental infections may worsen the condition of medically compromised patients."
Multiple sclerosis and other brain infections deserve special mention. Some excellent research indicates that the primary lesion in multiple sclerosis is an infected plaque around the venous side of the blood supply to the brain. Cerebral MS plaques show the same organisms as found in dead teeth.
September 2003, I went along to my dentist and had a root canal treatment performed. Months later, in January 2004, I started to experience problems with my balance, tingling sensations and numbness in my hands and feet. Subsequently, I was referred to a neurologist, and after many tests, CTI scans, lumbar punch, etc., I was told that the probable cause of my problems was multiple sclerosis. The amazing thing for me was that I had this root canal tooth pulled out in September 2004, and a week later, and literally a week later, my balance started to improve, and the sensations that I'd been experiencing for 9 months started to abate, the numbness, the tingling, and basically things have just improved from there, and we're now in December 2005.
The ends of the roots of upper molars and premolars are in very close proximity to the floor of the sinuses. Often the ends of the roots of these teeth are within the maxillary sinus. Infection or abscess at the end of these roots will cause infection and inflammation in the lining of the sinuses. This is called sinusitis. There is a strong and well-published association between sinusitis and multiple sclerosis and other brain diseases. There is a linear relationship between the incidence of multiple sclerosis and that of dental decay. Root therapies produce dead teeth in gold coffins, buried deep in the bone within inches of your brain. Dead teeth are toxin factories.
Finally, I agreed to have it out. Best thing I ever did. Not only did the pain stop, but all of my allergic reactions vanished, literally vanished overnight, and my health improved just 10, 20, 100-fold.
About 50 years ago, two German physicians, Drs. Ferdinand and Walter Hünecker, chanced upon a previously unknown cause of disease. From their findings, a new modality of medicine was developed, called neural therapy. Simply stated, any area of dead tissue, infected tissue or foreign body may act as an interference to the regulatory mechanisms of the body. It's called a focus of neural interference. These interference fields can either produce or potentiate disease states in other parts of the body, often corresponding directly with the acupuncture meridian on which the interference is located. Another German doctor, Reinhold Voll, has mapped the relationship of each tooth to the rest of the body. He found, for example, that the front teeth are on the bladder meridian, and that interference fields here may cause disturbances and disease in the kidneys, knees and reproductive systems of the body. The upper molars and lower premolars, being on the stomach meridian, may cause diseases in the breast. Wisdom teeth affect the heart. Many other relationships exist. If you have a dead tooth, it is worth checking these relationships against your own symptoms.
A couple of years ago, Robert extracted a treated root canal that I had put in several years before that, which was fine, everything came out, but I developed this pain in my right knee. It was on my right-hand side, this root canal, and I had a pain in my right knee, which was very bad, and I could hardly walk. Anyway, I came back the following week to see Robert and said, "What are you trying to do? You're killing me. Since you pulled this tooth out, my knee is just throbbing." Whereupon he put a procaine injection in the root socket, and the pain went like that, never came back.
Secondary diseases can become established not only at individual organs or tissues, but can also occur to a general extent as disorders of the autonomic nervous system. The focus can just as easily have an effect on the immune system, the blood, and the hormonal and endocrine systems of the body. The accepted treatment is to try to remove the neural interference. Take out the dead tooth.
The concepts of neural therapy are strongly denied by most Western medical and dental schools. In Germany, however, it is common medical knowledge, even taught at undergraduate level in medical schools.
We're taught that decay is caused by bacteria that produce very strong acids which dissolve the enamel of your tooth. This implies that the sole cause of decay is external to the tooth. However, in the late 1960s, Dr. Ralph Steinman published research which demonstrated that decay in teeth is related to the health of the whole body. His work showed that a healthy body produces a flow of tissue fluid from the inside of a tooth right out through the enamel. With this healthy fluid flow, there was no decay even when people did not brush their teeth. As health of the body is compromised, however, and this fluid pressure reduces, there is a corresponding increase in the amount of decay. He found that this fluid pressure, and hence the decay rate, was dependent principally on diet and stress. Sugar and white flour were amongst the worst in negatively influencing the body.
The logical approach then to caries control is a way of life which includes a sound nutritional program and freedom from stress. For many individuals, this would represent a changed way of life, but there is much evidence that the answer to caries lies in nothing less.
We could therefore question the sanity of putting fluoride into the drinking water when it is clear that dental decay is a systemic condition rather than a topical one. The fluoride that is put into drinking water is a toxic industrial waste product. The same type of fluoride is also used as a rat poison. Areas that are fluoridated have shown an increase in the rate of hip fracture caused by weakening of the bones, increased heart attack, increased cancer, increased infertility.
The Food and Drug Administration reported a close correlation between decreasing fertility rates in women and increasing fluoride levels.
They also reported that a review of all of the animal studies done to date shows that fluoride adversely affects fertility in most animal species. A huge Chinese study demonstrated a substantial drop in intelligence of children in fluoridated areas as compared to non-fluoridated areas. In May 2003, the Swiss government banned fluoridation of drinking water as they found in the 40 years that fluoridation had been used that it was an extreme environmental hazard and there was no demonstrable reduction in decay rate as compared to non-fluoridated areas. Fluoride does not stop tooth decay. Fluoride is not effective in reducing tooth decay. No correlation was found between the level of fluoride in water and dental caries. The respected Dr. Joseph Issels wrote in his book Cancer: A Second Opinion,
"My clinical experience has produced evidence of a causal connection between foci and tumour development. From this, it is clear that the advisable treatment for devitalised teeth is extraction. At Dr. Issels' clinic, on admission, 98% of the adult cancer patients had between 2 and 10 dead teeth."
Or can I put up with the two dark teeth and the headaches, or do I take the quantum leap and thinking, okay, look, I'm going to lose two of my old friends, and it's going to be a fairly major change, and I'm thinking, well, no, it's got to be better than the situation was beforehand, and straight away it has been.
Risk disease or have the tooth removed? Only you can make that decision. An important criticism to this approach is that by taking the tooth out, we're creating a biomechanical problem in the jaw and therefore the spine. It is of course important for a host of reasons to maintain what is called a well-balanced occlusion or bite. Question is then, which disease state would you prefer to risk? It's usually much simpler to fix a bite problem than a disease such as cancer.
I've had to have surgery and be on, they could have had to take out the whole gland, and I could have had to be on hormone replacement tablets for the rest of my life. I could have had to be on a drug called Dostonex, which had horrible side effects like depression and nausea every day for the rest of my life.
For most people, it is a relatively simple matter to replace missing teeth.
And a number of teeth removed, the abscesses have gone and all the amalgam's gone, and I feel like I've got a new lease on life and feel like a different person, and it's all fantastic.
There have been very few advances in root therapy in the last 300 years. At best, this practice is based in anecdotal evidence, not on science. The dangers of root therapy have been known for over 100 years. A root therapy tooth is a dead tooth. Dead, gangrenous material always remains in the tooth. It is not possible to sterilize a tooth. It is not possible to completely fill a tooth. All root therapy cements are cytotoxic. Some are carcinogenic. Some cause irreversible nerve damage. All toxins and all substances placed in a tooth are transported to the rest of the body. Amalgam implanted into the end of the root of a tooth is equivalent to implanting mercury directly into the brain. Teeth may affect the acupuncture meridians and thus affect the health of distant tissue. Root therapy has a 66% failure rate. Dead teeth cause the largest number of diseases ever traced to a single source. Teeth are an integral and important part of the body.